all of the legislators and dignitaries that we have in this room tonight. My name is Steve McCaffrey, and I'm very proud to be the President and CEO of Mental Health America of Indiana. Mental Health America of Indiana is fortunate to have the leadership that we have in this state, to be able to fight for what we need in terms of services and prevention in the area of mental health and addiction. And we know that your support comes sometimes from policy analysis that maybe we provide you, fiscal analysis, but it also oftentimes comes from your own life experience, the experience that maybe you're aware of among your friends or your family, or maybe even yourself. Many of you in the room may remember Representative Candy Marendt. I worked with Candy when she was in the Indiana General Assembly, and at that time, she was a champion for mental health legislation. And let me tell you, that was a time when mental health was not as popular as it is today. Not that it's where we want it to be. Candy's had her own life experience as it relates to our cause, and I thought there might be value in asking her if she'd like to say a few words, having been a legislator, coming from her as to it might be a way that could touch you in a way that maybe I cannot. So I invited her and offered her that opportunity, and frankly, she wasn't sure if she felt comfortable doing it at first, but she thought about it, and she decided it's just too important not to do it. So please welcome, a warm welcome, to former Representative Candy Marendt.
Good evening. I feel like I should say, Mr. Speaker and members of the General Assembly. It's been a while since I've said that, 25 years. There were no wheelchairs. There were no crutches. I didn't have an early intervention specialist coming to my house. But at a very early age, I knew something was wrong with my son. 6 weeks ago, I lost him to suicide. Although we have made many strides in the treatment of mental health, there is still so much that can be done. Mental health not only affects the person suffering from it, but the entire family. My daughter, who surprised me tonight from New York City, paid a yes, isn't she lucky? Proud mom. She paid a very high price too, because so many of our resources were used trying to navigate a system that was so complex and so difficult. There were doctor visits, medication that cost over $700 a month. Time spent searching for treatments affected our entire family. And we were lucky we had two very supportive, loving step-parents. My son, Gregory, is not an isolated case. I have watched my sister, who is my hero, Marilyn Moores, who is judge of the Marion County Juvenile Court, for the last 10 years, look for placement and treatment for kiddos in the state of Indiana. There were so few good choices. As a former legislator, I know the demands you face for worthy causes that require your time, attention, and most of all, funding. There are never enough dollars to go around. I just ask that when you consider current and future legislation, please remember sometimes the silent sufferers of mental illness. They are so deserving. We can do much, much more to provide necessary and desperately needed treatment. You have the ability to save lives. Thank you so much.